bedside
床
active
旁
and
下肢
passive
智能主被
rehabilitation
动
trainer
康复
for
机，
lower limbs,
主
mainly
要
for
用于早期
rehabilitation
卧
of
床
lower
患者
limb
的下肢
exercises of
运动
early
康复使
bedridden
用。
patients.
患者
Patient
卧于床
lies
上，
on bed
将
and
设
pushes
备
the
推
trainer
至
and
床
end of the
尾，
bed.
踩
Step on
踏
the
固定
fixing
装置，
device to
确
ensure
保
the
设备
trainer is
稳定
stable
牢
and
固。
firm.
连接电
Connect
源
the
线，
power cord, turn
打
on the
开
power
电源开
switch.
关，
Press the
按
lift
升降操
operation
作键
key to
调
adjust the
节机
height of
身
the
高度，
trainer. It
以
is
训练脚
advisable
部
the
固定
lowest
装置
point
的
of the
最低
foot
点
fixture
距
to
离
be
床面
10 to
有
20
10到
centimeters
20 厘
away
米
from the
为
bed
宜。
surface.
调
Adjust the
节训练
training
绳
rope
长，
length.
以护
Advise
腿
the
板
arm
臂
of the
杆
leg
与脚
guard
部
and the
固定
foot
装置
fixing
呈
device at
30
an
度左
angle
右
of
角
about
度为宜。
30. Place the
将
patient's
患者
leg
腿
on the
部
foot
置于
restraint
脚
and
部
leg
固定装
restraint.
置与腿部固定装置之上，
Use
使用
straps
绑
to
带
secure
将小
calves
腿
and
及
feet
脚
if
部
the
固定。
patient's hip muscle
若患者
strength is
髋部肌力
poor.
较
If the
差，外
patient's
展
hip
外旋
muscle
严重，
strength
可
is
调节
poor.
护腿装
Can
置维
adjust
度，
leg guard
以此控
dimension
制
to
异常
control
姿势产
abnormal
生。
posture.
在屏幕
Click
上
lower
方
leg to
点
enter
击
the
下肢
training
训练，
interface.
进入训练界面，
Choose
根据
training
患
mode
者情
according to
况选
patient's
择训练
condition.
模式，点击开
Click
始，
start the patient
患者
enters
进
the
入训
training
练状态。
state. Hand
将
the
患者遥
patient's
控器
remote
交
control
予
to
意
the
识清
conscious
醒的患者，
patient.
方便其
It
进
is
行训练
convenient
速度调
patient
节
to adjust
与
training
停止
speed
操
and
作。
stop.
硬
Hardware
件操作
operation.
一、
One pedal
踩踏
device.
装置，通过踩
The
踏动
device
作
is fixed
实现
and
设
the
备的
wheels
固
are
定
started
与
by
轮子启
pedaling.
动。二、连
The
接电源
repower
线，
switch.
3头插头，禁止随意更改。
The
三、
repower
电源开
switch.
关，位于
Located
机
under
身
the
下方。
trainer. 4.
四、
Body height
机身高度
adjustment.
调节，电动
Electric
式机
body
身调节
adjustment
装置，
device.
根据
Adjust
箭
the
头方
height
向
up or
进
down
行向
according
上
to the
或向
direction
下
of the
高度
arrow.
调节。五、
5. Training
训练
arm
臂
length
长度调
adjustment.
节，
Turn
扭
the
开旋
knob
钮，根
according
据
to the
患者身
patient's
高
height
或
or
所躺的
lying
位置，
position to
为减
reduce
少患者
patient
移动，
movement.
可根据需要
Adjust the
进
length of the
行训练
training
臂
arm
的
as
长度调
needed.
节。通过推拉
Adjust
训
the
练臂
length of the
进
training
行训练
arm
臂
by
长
pushing
度
and
调节，
pulling.
固定
Fix the
旋钮。
knob.
六、
6. Leg
护
guard
腿
length
板长度
adjustment.
调节，扭
Turn
开
the
旋
knob
钮，
set the
根
appropriate
据患
length
者腿
according
长
to the
设置
patient's
适宜
leg.
长度，以患者小
Fix
腿
the
中部
knob
的
at the
高度
height
为
of the middle
宜，
of the
固定
patient's
旋钮。
calf.
七、
7. Training
训
rope
练绳
length
长调节，
adjustment. Grasp
一
the
手
rope
抓
with
住
one
绳
hand
部
to prevent the
防止
rope
绳
from
脱落
falling
过
off
快
too，
防护
quickly.
板坠落。
Other hand,
一手
pull
拉
the
装置
black
上方
snap on
黑
the
色
top
弹
of the
扣，
device.
放
Place
置
a
适宜
suitable
长度，
length
松
to
开
loosen
黑
the
色弹
black
扣，
knob button.
扭侧
Twist the
方金
side
属
metal
旋钮
knob
使
to
绳收
retract the
回，
rope. Adjust
调
the
节训
training
练
rope
绳长，
length.
以护腿板
Advise
臂
arm
杆
of the
与
leg
脚部
guard
固定
and the
装
foot
置
fixing
呈30
device
度角
are at
左
an
右
angle
角
of
度
about
为宜。
30.
八、
8. Screen
屏幕调
adjustment.
节，
Turn the
扭
knob at
开
the
屏
back
幕
of the
后方
screen.
旋钮，
The
屏幕
screen
可
can be
进行
rotated by
180度旋转。
180.
根
Can
据
be
操作使
arbitrarily
用方
fixed
便性，
within this
在此
angle
角度内
according
可
to
任意
need.
固定。
Fix
固
the
定旋
knob.
钮，屏幕
The
仰角
elevation
可
angle
根
of
据
the
光线
screen
变化
can be moved
进
up
行
and down
90
in a
度范
range of
围
90.
上下移动固定。
9.
九、
Patient
患者
remote
遥控器，
controller.
遥控器
Patient's
放
hand
于
remote
患者手
controller
中，
and the
可
speed
进
can be
行速度
adjusted.
调节。当患
When
者
the
需要
patient
康复
needs
机停
trainer
止时，
stop,
可按
press
停
stop
止
to
键
stop the
将
trainer.
康复机停止。
10.
十、
Emergency stop
急停
button.
按键，
Located
位
behind
于
the
下
lower
肢
limb
训练臂
training
后方。
arm. When an
出现
emergency
紧急情况
occurs,
时，按
press
压
the
急停按
emergency
键，
stop button
训练停
training.
止，
Stop the trainer
设备
cannot
无
be
法使用。
used.
扭动
Twist
急
the
停按键
emergency，stop
按键
button.
弹
The
出，
button pops
设
up.
备恢复
The
正常，
device
可
returns
继
to
续使
normal
用。
and can continue use.
软
Software
件操作
operation. One
一、
equipment
设备
self-check.
自检，
To
为保
ensure
证
the
康复
safety
机
of
的
the
安全
trainer.
性，
2
每
to
次
3
开机，
minutes
康复机
self-checking
都会进行
process
2
every
至3
time
分钟
the
的自
trainer is
检过
turned
程。
on.
二、
2. Enter the
进入
training
训练界面，
interface.
点 基
Click
础
on
界面
lower
下
limb
肢训
training
练
to
即
enter
可
the
进入
training
训练界
interface.
面。
3. Training operations. According to the patient's condition, choose active and passive, passive or assist training. One of the training modes. Set the speed or resistance value as needed. Click Start and the rehabilitation machine will start the patient's training. 4. Active passive trainer mode.
此
This
模
is
式为
active
主
and
动被
passive
动自动
automatic
切换
switching
模式。
mode.
患者有力量
Resistance
时，
training
患
when the
者进
patient
行
has
抗阻
strength.
训练。
The machine
患者没有力
automatically
量
catches
时，
the
机
patient's
器自动
weakness
捕
when
捉
the
患者
patient has
无力
no，strength,
提供
provide
动力
power
供给，
supply
带
and
着
take
患者
patients
进
for
行运动
exercise
训练。
training. 5. Passive training mode. Powered by the machine to drive patients to exercise training. 6. Active training mode. The patient's own motivation to drive rehabilitation trainer move. 7. Assist training. In the active and passive mode, click to assist training to enter the assist mode. The assist mode can better capture the patient's slight force generation and encourage patients to exercise autonomously with minimum exercise requirement. 8. Speed adjustment. In active passive and assist mode, speed adjustment is possible. The adjustment range is 1 to 60 rpm. 9. Resistance adjustment. In active and assist mode, adjustable resistance value adjustment range 0 to 20 N. 10. Change direction. Under the premise of passive training, click to change the direction and the speed gradually drops to 0. Then the reverse movement speed gradually increases to set speed. 11. Entertainment. Click Entertain on the screen. Situational interactive training. Coordination training. Choose one to enter the entertainment interface. This training is for active training. The percentage content displayed on the screen is the percentage of the corresponding side limb exertion. For example, when the right side is forced, the percentage on the right will be greater than left. The ideal training goal is to show 50% on both sides. When the patient has spasms, the trainer can recognize the appearance of the patient's spasm. Trainer will automatically reduce the speed to 0 in reverse, thereby improving and relieving spasms. 13. Motion capture. Lower left corner of screen displays the patient's current movement in real time. Active, passive, spasms. 14. Pause. When you need to change the mode during training, or when the patient needs trainer to stop, click pause to stop the trainer. When choose a mode that needs or when you need to continue training, click to start the trainer to enter the training interface. 15. Exit. When the patient wants to end the training, click to exit. The machine stops. The training is over. Content of training report is shown on the screen. According to the prompt, you can choose to keep the data or continue training. Click to save data. You need to insert U-disk into the socket at the bottom of the screen. Import the training report into U-disk for archiving. Click Continue Training to jump to the main interface. Settings. 1. Click on the main interface to enter the Setting Tool interface. 2. Loudspeaker control. Click Loudspeaker control. When a red slash appears, it prompts that this function is turned off. This function is a voice prompt function. When the patient is training, trainer prompts the patient's current exercise status according to the training changes. Press the resistance plus and minus keys to change the movement resistance. This feature is off by default. Users can set according to their needs. 3. Spasms. Click Spasms. When a red slash appears, it prompts that this function is turned off. This function is anti-spasm control. When the patient has spasm, trainer can detect the spasm and relieve the spasm. If the patient is severely spasm, the training is always in the state of spasm protection. To ensure the training effect, can close the spasm. 4. Time setting. Click Time setting. Screen display time adjustment content. Set duration according needs. Adjust with plus and minus signs. The default training time of trainer is 15 minutes, in line with the length of hospital use. Generally no need to reset. 5. Motor power rating. Click Motor power rating. 3 options: high, medium, and low. Selection according to the needs. The default status is medium. If trainer cannot drive the patient to exercise during use, prompt the patient to need a higher motor power level. It is necessary to select a higher level of motor power based on original. 6. Voice control. Click Voice control. When a red slash appears, It prompts that this function is turned off. This is a safety protection function in case of unexpected accidents. Under normal circumstances, a person's stress response is to express through shouting. When patient has unexpected situation during use, shout loudly. Trainer accepts abnormal sound and automatically start the stop. This function is off by default. Can be set as required. 7. Level of spasm. Click level of spasm. 3 options: high, medium, and low. Selection according to the needs. The default status is medium. Select corresponding level of spasm according to the occurrence of the patient's spasm. If the patient is prone to spasm, set high. General spasm, set medium. Spasms rarely occur, level set to low. 8. Reverse time setting. Click reverse time setting. Show the content of select training direction interval time. Choose according needs: 2 minutes, 5 minutes, 8 minutes. Turn off timing reverse. During the training process, the trainer will automatically reverse according to the set time. This function is off by default. Users can set according to their needs. 9. About. Non-professional equipment maintenance or prohibit clicking about. To avoid damage to the trainer program, users are not recommended to operate the content in the about. 10. Cancel. Click cancel. The content in the settings will be restored to the default state content. 11. Confirm. Click confirm. The reset content in the settings will take effect.